Life. What is it? What is it? Life. Struggle.
My sisters.
Life. The hustle. Life. The survival.
Hey there, this is Dr. Drmoskillern. I'm a retired Army captain, military trained PA who went back to school, college, and got his doctorate degree. I am presently the president and CEO of the Physician Associate Interdisciplinary Clinic, or PAIN-C. I also oversee the medical piece of the Soldier 23 project. It's a position that I value greatly, the great things being done there. It is a needed thing that I'm glad that Sergeant Baskin was conscientious enough to dive into and get the process started. Okay, me and Sergeant Baskin served in uniform for a long while together, and so all that was necessary was for him to call me and let me know what he was doing, and I was in, which I am. In reference to that, in talking to you about your frustrations with the VA system and your frustrations with the process to get your service connection for your injuries you sustained while on active duty, I want you to understand. We understand. We understand your feelings. Both myself and Sergeant Baskin went through the same process. That's why he in turn set up the Soldier 23 project, and I set up the Physician Associate Interdisciplinary Clinic to try to help clear out some of these issues and problems or misunderstandings that come about when a veteran does not know the wording, the process, the paperwork, or what's in generally needed to get a claim started and to follow a claim. And in this instance, or in every instance that we are called upon to deal with these situations, we generally follow the veteran all the way through. So it's not a one and done deal. If you're in the state of Tennessee, I can do your CMP exam directly right here. I'm licensed to practice in Tennessee, also Georgia, but there's some things I got to get fixed there, mainly finding a doctor to cover me to do CMP exams in that state. But in the state of Tennessee, I can do the CMP exams. Sergeant Baskin can get a hold of the paperwork, review it, reach out to me. I also review it and assist in any nexus letters, write-ups, or assist the veteran in understanding what direction they need to go in to get this thing done, okay? We do what we do to cut to the chase, okay, to cut out some of the confusion. The more and more I do this, the more and more I find out that there are more and more veterans that don't know this information, okay? So, in saying all that, I don't beat up on the VA. Sergeant Baskin doesn't beat up on the VA. We're here to help you. We're both prior service. We both have been there. We both have been through this process. And administratively, we know what you need to do. So I would say, please, take a deep breather, okay? We're here to help you, all right? And like I said, we're going to help you all the way through it. That might be hard to believe, but that's what we do. Sergeant Baskin and myself, we have a passion to do these things because in our experiences, we've seen a lot of misgivings, a lot of misinformation, a lot of things being done that are not beneficial to veterans. Okay? Does it happen? Yes. Can we stop it completely from happening? No. But what we can do is fix the things that are brought to our attention. So by all means, reach out to Sergeant Baskin, or I'm a retired captain, so Captain Skillern. Whichever one is good for you is good for us. 9 times out of 10, I'm going to reach out to Sergeant Baskin. 9 times out of 10, 10 times out of 10, Sergeant Baskin is going to reach out to Captain Skillern. So one way or another, we'll cover you for documentation purposes. Sergeant Baskin can look through all of that, find the things that are most promising for service connection. When I say that, what he will do is look through your chart. Basically, anything you were seen for 2, 3, 4 times, any surgeries you had while you were in the military, any chronic issues that he comes across in the medical records. Those are the things he's going to recommend that you seek service connection for. Why? Because more than one entrance in a record, 3, 4, 2, 3, 4, shows a chronicity of that problem, which can, in most cases, lead to service connection for that particular issue. Listen to what I said. It can, doesn't guarantee, but at least finding it several times in your medical records will create a chronicity of a finding that could very well lead to service connection. Okay? Once you hit service connection, that's where, the evaluation for service connection, the evaluation for recompense or money you get for that service connection is all done by the VA. We have no issues or have no direct input in making that decision. But what we can do together is find out what's most promising by looking through your medical records and advising you what to submit. And if you're in Tennessee, I can do your CMP exam for you. Okay? Either by directly having you come into my office, which is in Memphis, or by telehealth. The VA is allowing telehealth CMP exams to be done on some issues. Mainly those are issues where I don't have to touch you to get measurements for. A shoulder, I can do that by CMP, by telehealth rather. But I'd rather do that one by laying my hands on you. That way I can have direct measurements to submit. Otherwise, to be honest with you, I'm making guesstimations from doing hundreds of them, which I do pretty good. But again, for shoulders, knees, stuff like that, hips, it would be better for you to come in. Okay? So anywhere in Tennessee, in Memphis, I can do your CMP exam for you. Okay? There's a few companies out there already getting paid to do your CMP exams. I have a contract with these companies, most of them, to do the CMP exams, and they just merely notify me to do either a telehealth CMP exam or an in-house CMP exam, which I'll do in my office. We'll do that, and once you get your results from that CMP exam, then we'll be there to help you after that point. Yes or no, if you're service connected or not. We will be able to be there to tell you or advise you on what measure to take next. If you are service connected, that's what we want. That's what all this is about, to get you service connected, you and your families, for injuries that you have sustained while serving this country in uniform. That's what we do. Whether I'm at home or in my office, that's what I do every day. When I'm not actually doing CMP exams, chances are I'm online looking up information in reference to the CMP exam on a veteran, or in general, just getting information on maladies or disease processes that are supported in the literature by the literature, basically. I use the National Institute of Health and other resources to find supportive documentation. So if there's meat on that bone, I will find it once it's put in our ballpark. So, as I was saying, you can get with Sergeant Baskin. Love him. I mean, serve the uniform with him. He's going to do an excellent job. Not just a good job, excellent job, through the Soldier 23 project. Or get with me, Captain Skillern, through the Physician Associate Interdisciplinary Clinic. I'll do the same thing. We'll get it done. But relax. Don't stress yourself out, especially if you've got PTSD. Stress is not good for you. Anger is a whole different animal. We know. So relax, calm down. And I guarantee you, beyond a shadow of a doubt, we will help you. We will advise you. We may not always tell you what you want to hear, but we will advise you with the best advice that can be given. I'm just going to say it. Why? Because we're dogmatic about what we do. Those things that made us good soldiers make us good CNP advising folks. We're dogmatic. If there's meat on the bone, we're going to find it. If there's no meat on that bone, no way, no how, we'll tell you that too. Okay? That's after we've exhausted everything. And what I mean by that, and I'll do this real simple. If you're in the military, hurt your knee, seen one time for your knee, one time, never again while you're in the military, weren't seen for that knee by anybody for 20 years, and you work construction or some other employment where you was tasking your lower extremities, then you started having knee problems. Probably not going to be service-connected for that one. Happened one time while you're in the military. No other times. Doesn't show a chronicity while in uniform. And if you weren't seen for it within a year after getting out, those are the criteria. You've got to have a chronic injury while you're in the military or within 1 year of getting out the military. Those are things that service connection is easy to get for. If you were seen one time for it, one time in the military, that's documented, not seen again for it for 20 years, then you started being seen at the VA for it. That leaves a 20-year gap in between the one time you were seen for it in service and the next time you were seen for it. That's probably not going to happen. You can fight, you can struggle, we can fight, we can struggle. I can write you a nexus letter, but what I cannot do is fill in that time in between the one time you were seen for it on active duty, 20 years later, that time you were seen for it. I can't fill in that time. Okay? Now with that, I'll add a caveat. If in that time you were seen for that knee problem by an outside provider, you can get that documentation. And it started, 1, 2, 5 years after you started having continuous problems? That's a possibility. But you got to get that documentation, got to see it. I can write a nexus letter with that information. Yes. That will allow me to say that you were followed by a provider beyond your time in service for the knee injury you acquired while in service. Yes, I can do that. I can create that nexus letter. Sign it with my name, put all my qualifications on it, and it'd be solid. Why? Because you've got the documentation for it. But again, if it is a injury you were seen for one time in the military, not seen for any more for 20 years, that's probably not going to happen. Can't say absolute. Would never say don't do it. Try it. We'll try it with you. But it may not happen because of that reasoning. But in any other case, reach out to Sergeant Baskin, as I said, at the Soldier 23 Project. Great organization. I support it 3,000%. If you're talking to him, basically you're talking to me. Or reach out to the Physician Associate Interdisciplinary Clinic, my clinic, in Memphis, Tennessee, by way of the information. I'll put it on the video, or Sergeant Baskin to have it ready for you. Either or, you're going to be dealing with the same people, Sergeant Baskin and myself. That's the way we do it, tag team. So we will look forward to hearing from you. We will look forward to you calming down, and we will look forward to you understanding that this is a process. Okay? You got to go through the motions. Unfortunately, the paperwork has to be submitted. You got to go through the motions, okay? Then the VA makes the decision. From there, then we can advise you, okay? So, guys, all the veterans out there, if you have injuries you sustain, you got to get service connected for these things, okay? These are things that will probably affect you later on in life. But I'm not going to drag on. Simply that. Reach out to Sergeant Baskin, Soldier 23 Project, or Drmoskillern, Physician Associate Interdisciplinary Clinic. We'll take care of you. Take care, guys. Look forward to hearing from you. Out.
Is it life when I got to roll the dice every day? My stress is hopeless, focus will I get paid? I'm a slave with no roots, wind blows, black boots. I'm a soldier, taught to kill to survive, but if I live with a thrive in a system, taught to hate me, I'm on the run, my only mission is living. When I get in position, you know it's me that hit you, sticky for your knowledge and riches. My vision, everybody wanna live, getting caught up in the struggle, no bling bling. Looking in my baby eyes, hoping for better things. Dream of a better place, get on my heaven, lay my head down. Hard times fighting the devil, I can't sleep. Gotta get up, I gotta get out. I can't breathe, thinking about the world up in my mouth. Lord, hear me, hollering cause I can't control it. My life twisted, birth to a million stories.
Can I rise above? Can I rise? Will my mind withstand? Will my mind? Should I strive until the end? Hey, can I rise above? Can I rise? Will my mind withstand? Will my mind? Should I strive until the end? Or is my life on trial?
Is it life? Do with anything under the sun. We hustle, filled with greed. I was taught to succeed, but never will I forget about my home. And so take my hand. You did some time and got in trouble, but you still a man. We used to roll in them streets for 15 years, scoping the game out, leaving the game out, and now I gotta take control and put my plan in motion. No more holding me down with that hocus pocus until the day that I die. To be no half stepping, cause I'm a warrior for life until I get to heaven. So don't you worry about no trouble, cause it's all around. And don't you worry about no burden, just lay it down. And put your game face on, cause you a player for life. And put your eyesight on, cause you a nigga for life. You in a system behind the line. When you think about it, lost time is one crime.
Can I rise above? Can I rise? Will my mind withstand? Will my mind? Should I strive until the end? Hey, can I rise above? Can I rise? Will my mind withstand? Will my mind? Should I strive until the end? Or is my life on trial?
Is it life making moves for the money? Everybody got a price to pay. Ain't nothing funny. Why you looking at me crazy? You's a pun in the game. 'Cause